This protocol provides a comprehensive oral health screening that assesses the risk of oral disease and response to its management. Non-oral health professionals can perform this oral screening, which includes the measures and perceptions of both the observer and the patient.
Oral health influences many systemic diseases, including type 2 diabetes, heart disease, and arthritis. Tracking oral health changes over time informs health providers of oral and systemic disease risks. Rather than timidly inspecting the oral cavity, we recommend the practicing of the screening on friends and family until you're comfortable entering this personal space.
Demonstrating the procedure with Dr. June Sadowsky will be Jordyn Stanek, a research technician from my laboratory.
To administer a go-high or swallowing subscale of the ROMP, have the patient sit comfortably and ask the patient to consider the last 3 months. Ask the questions one at a time, marking the patient's answers on a paper or digital copy of the questionnaire. At the conclusion of the questionnaire, thank the patient and ask if they have any comments to add. Then score the questionnaires by the additive or simple count methods. Before completing a BOHSE, obtain a paper copy of the questionnaire for the oral screening and recruit an observer to serve as a scribe to speed the examination and to prevent infections that can be spread, for example, by touching pen and paper and then the patient's mouth. Ask the patient to sit comfortably and inform the patient to expect